Geoffrey Mutuma from the Zambes Hospital, which is in South Sea, Mayo Road. The hospital, we focus mainly on cancer awareness, we focus on cancer screening, and also the cancer diagnosis. Most of our patients actually are cancer patients, and we also do other diseases because we are cancer general hospital. We do other diseases today, and of course mainly for this month in July, and also in part of August. I want to discuss about diseases which come from because of coldness. When it's very cold, we normally have a lot of diseases which normally occur when it's very cold. Like now in July, we have got all coldness, and most of the diseases which are there now, and they started in June. We find that in these 2 months, in fact 3 months, we have got diseases which are peculiar for this time, and this mainly the diseases which we see patients at this time, and these are diseases which come because of cold weather. And I think in sometimes in 2 weeks or 1 week ago in June, there is sometimes when even the government announced that there's as if there's a wave of COVID, and people were advised to wear masks and to prevent the spread of COVID. Of course, it came and went. Of course, we had a bit of surge, a bit of increase on COVID cases, and we expect, of course, to be common in July. Now, the fact is that COVID is a viral disease, and most of the cold weather, when it's very cold, we have got a lot of viral infections, which I'll be able to mention so that at least you can be able to follow and know what you need to do as one of the followers of our channel, and what you need to do in July. And that's why in July we have got mainly pneumonia, which is very common, especially in young children, or even in adults, and more so in the elderly. We also have measles, which is common mainly in children. We also have common cold, which is called influenza infections, which is also very common at this time. And we have other diseases like mumps and other viral diseases like hemorrhagic fevers are very common at this time. Of course, in Kenya, we don't have hemorrhagic fevers. The hemorrhagic fevers normally have them in Congo. We have some in Uganda, some in Cameroon, and others in parts of Mali and Senegal and Ghana. Those are diseases where will along the tropics, along the equator, and they come at this time because it's very cold, and these diseases, they like the cold weather, and also meningitis, which also likes the cold weather. So these are the few of the diseases which I'll be able to discuss in a bit of detail so that people can be able to follow, and those who are following my channel can be able to benefit from what is happening nowadays. And in most cases, apart from cancers, which I'll be discussing and continuously, I'll be able to focus on few diseases which are there at a given time, because with the diseases which are there in a given time, they are normally very important, so that at least as you follow our channel, you can be able to benefit. Now, pneumonia is very common nowadays because of cold weather, and pneumonia is a bacterial infection, not a viral infection. It's a bacterial infection, which it occurs mainly in July, in September, in August, and a part of June. This is because it's very cold, and when it's very cold, these diseases become very common because they are exaggerated by cold weather. It does not mean that you cannot get pneumonia at any time. You can get pneumonia at any time, but pneumonia becomes very common at this time because of coldness, because of cold weather, and pneumonia is a bacterial infection which is called strep pneumonia. You can have also bacteria of another bacteria called Pseudomonas, and that's to find that bacteria infections if they become very serious in cold weather, and that's why most people at this time they have pneumonia, and pneumonia is a acute disease. When you've got pneumonia, you can really survive for 1 week when you've got real pneumonia, because pneumonia is progressive and it's fatal, especially in children. When you've got pneumonia, by the third day, you are so sick, you cannot be able to breathe. How do you present when you've got pneumonia? First, you have fever. Second, you start having coughing, and the cough is productive. We normally cough productive, can have a dry cough, but cough for pneumonia is normally productive. You produce either the yellow sputum if it's strep pneumonia, or green sputum if it's Pseudomonas. infection. So there's a difference of which infection you are having, and that's where there's a difference in terms of the disease of the bacteria which you have. And apart from this cough, you have a lot of pain in your chest. When you breathe in, you find that you have to cut your breath, and because this is a lot of pain, and that's why when the children, even adults, when they got pneumonia, they normally breathe and cut their breath, and they produce a sound, and that's normally because of pain, because of lungs are very hard. When somebody has got pneumonia, he has got what we call either gray hepatization or red hepatization. That means that your lung, which looks like a sponge, it becomes as hard as a liver, and that's what we call it hepatic red hepatization, because the lung are as hard and the liver, and they are not allowing oxygen to come into the lungs, and you lack oxygen, and somebody has different breathing. And to diagnose the pneumonia, actually we just need to do the X-ray, nothing else. And apart from the signs and symptoms, and what you find when you put the stethoscope on the chest of that person, there's normally what we do a chest X-ray. That's diagnostic, and most of the patients can be treated very easily. Now, when we know that you've got pneumonia, it means that treatment must be done very fast. And the treatment for pneumonia is quite fast and very easily done. And the treatment pneumonia responds to treatment very fast. And that's why when you've got pneumonia, treatment for pneumonia is normally very easy and very fast. And most of the times when you've got pneumonia, by the time you take 12 hours, you have already treated and cured you of pneumonia. It's normally very important to make sure that at least you come for the hospital, because like children, the young children, when they are very young and they have pneumonia, but within 2 or 3 days, they'll be gone because of pneumonia. But if you bring that child to a hospital and the doctor makes the right diagnosis and gives the right treatment, within 6 hours, that child will be okay. And that's why it's acute disease, which also treated very easily, and the cure rate are normally very high. And that's why pneumonia can be quite serious. And that's why at this time, pneumonia will be very serious. It's good both for adults, for young children, and more so in elderly. It becomes very serious, and people actually, when they have it, during pneumonia, actually the progression is very fast. Now, another disease very common this time is common cold, which is called flu.